Late presentation is one thing we've seen almost every day in the hospital, and people don't present to the hospital until the symptoms are now so bad. One thing I tell everybody is that catching an illness early helps in better management of whatever you are feeling, and this is one mistake I would never make as a doctor. Once you notice any symptom, it is very important to follow it up early. So today I am going to be pointing out some symptoms you should not ignore. The first symptom you should not ignore is unexplained weight loss. I see so many persons come to me, and the first thing they will tell me is that they've been eating well, they've not been exercising, but they've noticed they've been losing weight. Even they don't want to lose weight, but they end up losing weight. There can be several things that can cause you to lose weight even when you don't want to lose weight. It can be a thyroid disease. There's what we call hyperthyroidism, especially for ladies. So you might want to get yourself checked. Am I producing so much thyroid hormone? Am I having what we call hyperthyroidism, that is increased thyroid hormone in the body? Because most times it can cause weight loss even when you don't want to lose weight. You see yourself losing weight. Another thing you want to check is diabetes. Something like diabetes can actually cause weight loss. Another thing that might cause this can be cancer. Though that can be an extreme thing, but then you don't just rule it out on your own until it is ruled out. One thing about cancer is when you discover cancer early, it has a better prognosis than when it's discovered very late. And that is why it's important to do routine medical checkup, because cancer cannot even be detected until it is late. Okay, so if you have a family member that has there is history of a particular cancer in your family, you might want to screen yourself as you are getting older, because most of these things come with age. Okay, so if you notice that you are slimming down, you might want to do a medical checkup to know what is actually happening. Don't ignore this sign. If you're not exercising, if you are eating well, you are sure you are eating well, and you are not doing strenuous activity that can also make you to lose weight. If you're not in this category of people and you are relaxed and you suddenly lost 10 kg of weight, 5 kg of weight, you are losing weight, please, you need to present to the hospital so that you'll be checked up. Okay, the next symptom you shouldn't ignore is a consistent cough for 2 weeks. Please don't ignore this. You can say, okay, cough can come and it can last for at least highest 1 week. But if you've been coughing for up to 2 weeks, you might want to come to the hospital. Please, you should come to the hospital for proper examination. Except there is a blood pressure medication that can actually cause cough, chronic cough, that's lisinopril. So if you've noticed that you're on lisinopril and you are coughing, okay, it's the medicine. One of the side effects of the medicine is that it can precipitate cough. Okay, so you might want to see your cardiologist and discuss further with him. Apart from this group of people, if you've been coughing for more than 2 weeks, please, you need to come to the hospital and then let us examine you, especially if you are immunocompromised or if you are old. In fact, everybody, if you're going for more than 2 weeks, you need to come to the hospital. And then I'm even extending it to everybody. If you've been coughing, first you will not be comfortable. You've taken all antibiotics in the world and you are still coughing. Is it not time for you to come and get yourself checked up, right? It can be a sign of TB, it can be a sign of heart failure. So don't just sit down in your house and then be taking antibiotics. It's not every cough that needs an antibiotics of syrup. So please, I know you know some medication. You've googled some of them online, and immediately you are coughing, you're already taking cough syrup, you are taking antibiotics, you are taking a lot of things. So, and the cough is not coming down. Is it not time for you to see a professional so that you can be managed properly? Have you asked your neighbor, is it not time for you to see a professional so that you'll be managed properly? So the next symptom you wouldn't want to ignore is frequent headache. I work in a diagnostic center and I see people walk in and they will tell you they've been having this headache for the past 6 months, the past 1 year, and you'll be wondering, what have you been doing? They will tell you, I've been taking paracetamol, I've been taking malaria drug, I've been taking typhoid and I've been treating typhoid and malaria. In fact, I don't even want to go to the fact that everybody in Nigeria, everybody in my country is treating typhoid and malaria once they have headache and fever. So if it's not typhoid and malaria, then like the way we treat typhoid and malaria, even the malaria and typhoid, so they will fear. If I am female Anopheles, I will not infect Nigerians again. And if I am Salmonella typhi, I will just run. In fact, because even before I come, they've already given prophylaxis. They've Nigerians, but as well, because we have access to drugs. Everybody can get drugs. So once you have any symptom, I will talk about this abuse of antibiotics. I think my next video should be on this, so that I will tell you the implication of abusing antibiotics anyhow. I don't want to talk about what's the name of this one they used to take for typhoid, Cipro, fluoxacin. Everybody in Nigeria knows Cipro. Everybody in my country knows Cipro. So I don't want to talk about this one. But one day I'll do a video to actually tell you the implication of taking antibiotics, because I don't think you know, because if you know, you will just reduce and make sure you take antibiotics when prescribed by a doctor. So if you're having frequent headache, you might want to get yourself checked out. How is your blood pressure like? Okay, because most times people come and the headache is just because their blood pressure is very high and they don't know. It's more among youth now, so I don't even know why, and I'm thinking of doing a research on that, but let's see how it goes, because I have noticed that younger people now, 20 to 35 years, they do have hypertension now, and it's something that bothers me, because I know while in medical school, no, it's not as if it's completely ruled out, but then it's not something that is that common, but I've seen it very common, okay? And I just asked myself, what could be the cause? But that's by the way. I think I will discuss about that maybe next video that I'll be doing, okay? So when you're having constant headache, you might not just let that go for 6 months, 3 months. The headache, you've been treating typhoid, malaria, typhoid. You've researched your symptoms on AI and you've been told what to do, and yet this is not going. What do you need to do? I think you need to come to the hospital. Let's examine you, ask you some questions, and do some tests, okay? So that we'll be sure that this headache is not as a result of maybe tumor. You might be asked to do an MRI to rule out any tumor. And meanwhile, I think I wouldn't stress much on this headache, because I did a full video on chronic headache. The video is "This is why you keep having constant headache." You might want to watch that video. At least it will help you to know how to deal with headache and the type of headache you are having, okay? So that's by the way. The next symptom you shouldn't ignore is frequent urination, okay? If you are urinating frequently, like, it's not nice. There is something we call frequency in medicine, and you know, it's not just that you are urinating frequently. You would be pressed and you will go to urinate and you will just urinate small. You will feel like you just urinate small, and then you go back, and after some time you are pressed again. You excused yourself and you went to the restroom only to discover that it's just small. So if you're noticing this kind of thing, it's not something that you should ignore, okay? In fact, most people don't ignore this because it's very uncomfortable, right? It's very uncomfortable. So most times UTI, urinary tract infection, is something that people don't ignore because it's uncomfortable, and sometimes it's painful. You can start having painful urination. So people don't ignore that, and that's why we say in medicine that pain is a good prognosis, because people don't ignore it. But anything that is silent and there's no pain, people ignore that. But then here is where I want to come in. When you're having frequent urination and every time you want to urinate, it's bulky, it is much, right? I want to join three things together. So if you've noticed that you get hungry very easily, you eat a lot, but you still get hungry easily, and you easily thirst, like you're always thirsty, so you take a lot of water and then you go and urinate, and each time you urinate large quantity of urine. So this one differs from the last one I said, that you go there and urinate more. That one is another thing. So I want to talk about this one because this one, most people don't see it as anything because there is no pain. The other one, usually maybe there might be pain and people will just run to the hospital because of the pain. But this one I want to talk about now, this one usually there is no pain. So you just urinate, like, I didn't urinate too much, but as long as there is restroom, polyphagia, polydipsia, and polyuria. These three things together can be a sign of diabetes, and you shouldn't ignore this sign. Come to the hospital, let's check. The test for diabetes is cheap. Okay, you can be asked to do fasting blood sugar, 2-hour postprandial, even hemoglobin A1C to monitor your sugar level for the past 3 months. Simple tests can dictate that so that you control your blood sugar level. I think I should do a video on diabetes, right? If you want me to do a video on diabetes, just drop it in the comment section and I'm going to do a video on diabetes. Okay, so the next thing I would want to talk about is persistent fatigue. You eat a lot, but then you are always tired. It can be a sign of anemia. It can also be a sign of diabetes too. Okay, you're just tired because the sugar you have is not being used by the body, it's just floating there, and so you are tired, you get hungry easily with other things I've said. Okay, so don't once and take just one symptom, be like, oh, I have diabetes. You make sure, in fact, before you say you have something, that is why we have doctors. Okay, with your history we are going to know which one is happening. Okay, so maybe you've not eaten, that's hypoglycemia, that's why you're tired. Can even be heart failure. Next thing I would want you not to ignore is when you've noticed that you're having shortness of breath. For example, when you are talking, you talk for some time and you feel so tired. Like you discover that, oh my god, you cannot walk from there. Once you climb the staircase, you feel like you want to die because you'll be having shortness. What there's something called shortness of breath in medicine. Okay, it's not a very good sign. Okay. And if you are hypertensive, if you're diabetic, or if you have all this hyperlipidemia, maybe cholesterol level is high, your leg is swelling, and when you lie down at night, it will be as if you can't breathe. You have to sit up so that you can catch your breath. Something is wrong. If you're having these symptoms, please don't stay at home. Come to the hospital, it's important. And then your leg is now swelling up and you are still at home. Do you want to call it the ambulance? So please, if you're having these symptoms, just come to the hospital. Sometime last month, there is a man that I consulted a man. He had his legs were swollen, the both of them were swollen, and he came in. He said that if he talks for some time, he will get tired. He will start trying to catch his breath. He'll be having shortness of breath. I asked him a few questions and I told him, even without doing tests, I know what is happening to you. But we're just going to do this test to confirm, and we did the test and we confirmed. Okay, I referred him to a cardiologist and he went there. He started his medication and today he's okay. Okay, if he comes for checkup again, I see him smiling, he's okay because he eventually came. Okay, but some persons will be having these symptoms and they'll be at home, and some persons will now go and see a traditional healer or will be taking herbal concoction so that everything will go. Please, we said knowledge is very important. Okay, so I'm creating this public awareness so that you don't just waste your money, you channel your money to the right place. Okay, I want to end this video without saying one important thing that I have noticed working as a doctor in a diagnostic center. Bring people to the hospital more than any other thing. So in fact, I don't think I need to stress on this, but then let me just add it. If you notice that maybe any limb, upper limb, lower limb, any of your limb, like you're having this electric shock in your hand and you're having kind of a radiating pain, radiates up, or from your buttocks that radiates down. My dear, don't skip that for a long time. In fact, I'm not even going to, because I know that you will come to the hospital. Most times, this can be a sign of spondylotic changes within your spine. You know, some persons won't come up to see the doctor before running the test. So some persons will go downstairs and they'll tell them they want to do an X-ray of the hand. The X-ray of they say hand anyway, but it's actually forearm. They want to do X-ray of this place, and they will ask them, please go up, so that the doctor will guide you. Okay, so most times we act out of ignorance. Okay, so if you're having these symptoms, you don't need to do an X-ray of that particular place. Most times it's not that place. Okay, though sometimes pain can be localized, but then that kind of symptom, go to the hospital. It is not that thing you are thinking. It can be a change within your spine that needs to be examined. So what are you going to do? So when you've noticed any symptom, get a book, get a pen, get a book, okay? Note the pattern and the presentation of the symptom you are having, so that when you come to the hospital, you can give the doctor a detailed history, okay? So whenever the doctor is asking you a question, you're not just guessing, or you're not just putting up something, okay? Your history, I'm getting like 60% of my diagnosis. I'm making my diagnosis from your history, and then examination will now give me like 40% to make an accurate diagnosis. And of course, investigation is to support my diagnosis most times, because as an internist, you know you're very, very meticulous while dealing with patients. So you have to give us good history. That is why I'm advising you to take note of the pattern, take note of the presentation, take note of the timing, take note of things that makes it worse, take note of the timing, very important, the time it started. All these things, they are very, very important in medicine, so that you can give us a better history, right? So that concludes my video. So one thing I will not do as a doctor is to sit and watch my symptom gets worse without going to the hospital. Take care of yourself. You know, I advise people. I'm a believer. I'm a Christian doctor. I love God. I love Jesus. I love prayers. I pray for my health. In fact, I declare the word of God over my health, and very nice. But you know, there are some principles that you should follow as a child of God. We are not ignorant, right? So you should know about your health. In as much as you are praying for yourself, you're praying for your health, you are declaring the word of God over your health, you should also be intentional in looking at it. Don't be ignorant about some important things you should look out for. Don't live your life carelessly. Be intentional about your life. I do say we can never be too careful. Illness that will come eventually, but to an extent, there are some things you can prevent by being careful with your health, by looking at yourself, by being intentional. Okay, people die from different diseases every day that can be avoided, that can be prevented if presented a little bit earlier. Bye. See you next week. I teach you how to be excellent, right? I'm a doctor, so I teach you how to be healthy. And then I'm a Christian doctor, so I teach you how to love God more. So these three things are things you'll find in this channel. So if you know that this video has helped you, and you know that you're interested in these three things, you might want to subscribe to my channel, and let's form a big community together. Bye. See you next week. Which video do you want next week? Health talk, academic talk, or Christ talk? See, I'm not getting. Come on, baby.